Welcome to the talk on lubrication, wear, and corrosion. Wear is defined as the progressive removal of material from contacting surfaces in relative motion. Adhesive wear occurs by the transfer of material from one surface to another when two surfaces articulate against each other under load. The transferred material could break off and act as third body particles, resulting in abrasive wear. Abrasive wear occurs when material is removed from a surface by hard asperities on the counterface and hard particles, third body, trapped between the two contact surfaces. Corrosive wear occurs by the combination of mechanical wear and a chemical reaction. Tribology is the study of friction, wear, and lubrication, and there are different types of lubrication. Fluid film lubrication occurs when two surfaces are separated by a layer of fluid so that opposing surfaces do not touch each other. Friction is then governed by fluid hydrodynamics. An example is a car hydroplaning on a wet road, or two wet pieces of glass stuck together but sliding smoothly over each other. Fluid film lubrication then moves to boundary and mixed layer lubrication, and the diagram shows a decreasing lubricant film thickness with hydrodynamic or fluid film lubrication in the top picture, and then moving down to dry lubrication at the bottom. Fluid film lubrication is a very important concept in hip replacement surgery. The left-hand diagram talking about squeeze film, I would like somebody to look up and explain during the tutorial. On the right-hand side is a diagram depicting what will happen in different scenarios with fluid film lubrication in a hip replacement. In 2010, an orthopedic product was recalled from public use due to high rates of failure. Please look this up and tell me which of the diagrams A, B, C, or D was thought to contribute to this failure. Synovial fluid is an ultrafiltrate of blood plasma plus hyaluronic acid, glycoproteins, lubricin, proteinases, and collagenases. Hyaluronic acid is a glycosaminoglycan. Proteoglycans are proteins that are covalently attached to one or more glycosaminoglycan chains. Various factors will affect wear and the type of lubrication that will occur at various points during the gait cycle in a hip replacement, for example. Have a look at the Strybeck curve and explain why hip resurfacing arthroplasty is not recommended in small-sized individuals. Wear depends on the materials used, and the body's response depends on the material and the size of the particles that are released. The picture shows commonly used materials in bearing surfaces in hip arthroplasty. A is metal on polyethylene, which we commonly use at Grotescare. B is metal on metal, as in hip resurfacings. C is ceramic on polyethylene, and D ceramic on ceramic. The body responds to these particles in various ways. Commonly, a granuloma will form with polyethylene particles, and this is the vast majority of revisions that we are seeing from the old style polyethylene done more than 10 or 15 years ago. Commonly with metal on metal resurfacings, the terms you need to know about are adverse reaction to metal debris, adverse local tissue reaction, aseptic lymphocyte dominated vasculitis associated lesion, and pseudotumor. The electron micrograph shows histological features of ARMD. The problem is that these lesions can become very destructive to local soft tissue structures, resulting in severe pain as well as dysfunction.